All right, thanks for that, Kyle. For many families, cancer is a reality. It's even more concerning when children have cancer. Well, September is Childhood Cancer Awareness Month, and while a difficult thing for any family to fathom or endure, it is a topic we do need to talk about.
And joining us this morning from Gundersen Health System is pediatric oncologist Dr. Toni Peters to share some insight. Good morning. Thanks for joining us.
Good morning. Thank you for having me.
So, Dr. Peters, just how common is childhood cancer?
Yeah, we tend to think of childhood cancer as being fairly rare, and it is rare compared to how often cancer is diagnosed in, say, the older adult population. But the reality is about 45 to 50 children are diagnosed with cancer every day in the United States. And that translates to about 1 out of every 280 kids will develop cancer before they reach the age of 19. So it's really not as rare as we'd like to think, and it affects many people even right here in our community.
And doctor, of course, there's always research, there's always advancement into treatments for cancer. What advancements have you seen on the childhood cancer front?
Well, I think pediatric oncology is one of the great, almost medical miracle type stories of modern medicine. It went from almost a certain fatality if a child was diagnosed with cancer in the 1950s or 1960s, to a survival rate of about 58% in the 1970s. And now when an individual shows up and I have to tell them that their child has cancer, it very much depends on the type of cancer, but overall survival is over 85% for all childhood cancers at this point in time. And in recent years, we've made more developments that have helped those kids where the cancer comes back and have done better at helping to save those kids with relapsed cancer. And so that's been some wonderful news in the last few years.
And one of the things we've heard is that treatment for cancer is often standard, but when it comes to our children, many parents would do anything to help them. So is cancer treatment standard across most hospitals?
It really is, especially for pediatric cancer. There is a group called the Children's Oncology Group that was started back in the 1960s. And it's a cooperative group that includes basically every hospital in the United States that treats children with cancer, and many hospitals around the world. So basically this group has protocols for how children should be treated and develops clinical trials for trying to continuously advance our care for children with cancer. So because most hospitals are part of this group, if your child has cancer, you would be offered the same, they would be offered the same therapy here in La Crosse as they would be offered in New York or Texas or wherever you may be. There are some rare situations in children with relapses of cancer or very rare tumors where there may be some individual trials at very specific institutions. But we typically help facilitate that for our families if there's somewhere that's better for their child to receive treatment.